Good afternoon, everyone. The meeting will now come to order. Hello, I'm Donna Savigny, President of the Board of Education, and I would like to welcome you to the December 2nd, 2020 Board Updates meeting. In keeping with the Board's commitment to open communication with the community, this meeting is being streamed live on the CCPS website at www.carrollk12.org and broadcast live on Channel 21. We are also recording this meeting so that it can be accessed on demand on our website and broadcast throughout the month on Channel 21. This will be a hybrid meeting in which board members are present in the boardroom. However, staff will be participating virtually. We will not be holding citizen participation during this meeting, but citizens and employee groups are welcome to submit comments via email or U.S. mail to the board for public comment. Comments received will be published on our website. For board members and staff who are participating in the virtual meeting, I would remind us all to silence our cell phones and other devices around us that the microphones may pick up. Also, we should each silence our microphones when we are not speaking. Now, please stand for the Pledge of Allegiance, followed by a moment of silence. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you. Now I would need a motion for the approval of the agenda.
So moved.
Moved by Ms. Battaglia,
Second.
seconded by Mr. Kyler. Board members, any questions or changes? It's a pretty straightforward one. Okay, then with that, I will call for the vote. All those in favor, can I get a verbal aye, please? Aye. Any opposed? Passes unanimously. Thank you. So we will move straight through public participation because we do not have public participation this evening, and straight into the COVID-19 updates. So we have the Health Department dashboard, and Dr. Lockard, I'll shoot it over to you.
Thank you, President Savigny. Good evening, everybody. Mr. Singer is on the line with us, and thought it'd be appropriate to go ahead. And at the last meeting, we had said we want to come back and take a look at the metrics right out of the gate. And so Mr. Singer is here to provide us with an update. So, Mr. Singer, thank you for joining us.
Yeah, no problem, Dr. Lockard and board members. We could get the presentation up. I think you guys have it to load. Just let me know when it's up there. And I guess while I'm waiting for it to get loaded, I could say, you know, if you listen to the governor this week, the state's a little bit more in a little bit more of a crisis mode. We're kind of unfortunately back to very high case rates, higher than we even saw in March, and approaching hospitalizations that are at the highest level of the pandemic. Fortunately, the death numbers aren't spiking quite that high, but there are a lot of things that have not moved in the right direction recently, and we'll talk a little bit about that as we get into the numbers tonight. Can you go to the next slide, please? This is a dashboard that we've been sharing with you since we started talking about reopening schools and things of that nature. As you can see, the cases were down slightly this week. Well, they were down significantly this week. However, I think that's really more a factor of a lot of testing sites, including our own, weren't open over the holidays, so access to testing was not as readily available as it normally has been. I would hope that we're reaching a peak and back on a downward trend. But yesterday we had 71 new cases, which is the highest level of new cases we've had in one day in any single day during any week. We were much better today. We had less than 30, but I'm not sure that we've seen the peak in new cases. And if you listen to the governor, he was expecting that we might continue to see a climb for a couple of more weeks. With travel and the gatherings related to Thanksgiving, that might also cause us to see increases over the next couple of weeks. Last week we had 7 deaths in the county, which is the most that we've had since back in May. 2 of those were community related, as you can see here on the dashboard. Hospitalization statewide are struggling a bit. While our ICU wasn't overly taxed last week, they are still seeing a lot of PUIs and COVID positive patients at Carroll Hospital, and all of the hospitals statewide have been asked to come up with surge plans and submit them to the Department of Health. The other thing that I'll mention is I thought we might get a break as we've gotten away from hybrid, but we did have an outbreak in one of the schools this week that was reported to the Department of Health with 5 cases. We were looking at another school where we had a total of 8 cases, but I actually don't think that's going to relate to an outbreak, but it's quite indicative of this community spread that we have to see 8 cases in one school, even if they're not related to transmission within that school. So that's a lot of cases for one place. Today, where we stand with the 7-day positivity as of this moment is 5.5%, and the cases per 100,000 is actually up to 23.2, which is a little bit higher than where it was at the end of last week. So, not sure. Like I said, I'm not sure we've hit the peak, and we'll have to see where that goes. Next slide, please. This is the total cases per week. This is the CDC metric that we've been looking at related to the risk of transmission in schools. Next slide. This is this is the slide we've been looking at with the state guidance on it, where the states essentially has this range of less than 5 or less than 15 per 100,000. I mean, I guess less than or equal to 5 per 100,000 and less than 15 per 100,000. There's a range there that they're looking at, and the less than 5% positivity rate that we're trying to take a look at. And right now we're pretty high over that. I'm hoping at some point in time, if people are doing the right things, we'll hit this peak and we'll start to see a downward trend, and we can start having conversations about what it would look like when we get down under the 15 cases per 100,000 to get back into a hybrid model with the schools. Now we're still, I think we're a little bit outside the box, and I think the flexibility is not unwarranted because you guys are trying to keep some in-person learning going on. I mean, essentially the guidance says that, that really we're off the charts, and I guess if you were to read the guidance literally, schools should be closed. But I think that, you guys are taking reasonable precautions and you're trying to deal with this as best that you can at this point in time. And we're going to have to just kind of monitor where this goes. But the thing that we've been talking about with your staff, and I guess I want to talk about this here because as we're talking about the guidance for Maryland schools, if we can get down below the 15 cases per 100,000 and whatnot, we want to start taking a look at treating the COVID-like illnesses a little differently than we have been, because I know that's really been hitting Dr. Lockhart and the staff very hard in being able to even staff a hybrid model when we've had to exclude everybody from the classroom when we have somebody with a COVID-like illness and they've had close contact with anybody. And I think the state's given us a little bit of flexibility to try to do some interpretation with this. And I'm not prepared to talk about exactly what that would look like, but just conceptually, we want to be able to get teachers and keep the kids in school. And when you're down to a lower case rate, the assumption would be is that the illness that the child might have or that the staff member might have is probably not COVID, but we're really going to need the cooperation of the staff and the parents on is we're going to need them to make sure that they take the child to or the staff member goes to their primary care physician and gets evaluated so that we can rule COVID out. That way, regardless of how we do this, we need to get COVID ruled out, because if you get into 4 or 5 days, that's where the highest risk of transmission is. And COVID hasn't been ruled out in somebody that has a COVID-like illness, then we're going to have to quarantine the students and keep them from coming to school. And I think in order to keep things operating, we really need the cooperation of folks to, if somebody has to be sent home sick, we need to get the doctor to rule out that the child had COVID so that we can keep classes operating in person when we go back to this hybrid model. But we do need to be down to, a relatively low number of cases per 100,000, definitely less than 15, before we would be looking at doing this. Because at this point in time, if we're above 15 cases per 100,000, if somebody's sick, I would assume that they have COVID as opposed to the opposite. So we're trying to work with your staff on that. The other thing that we've been talking about is potentially giving exemptions for staff to continue to work if they've been exposed to somebody with a COVID-like illness. And this isn't anything really different than what we're doing for fire, EMS, police, and other essential workers, healthcare workers, and things of that nature. And it doesn't put the staff at more risk, but especially when we're telling somebody to quarantine, we're quarantining them to keep them away from other people because they might become infectious. What we would do and what we're developing is ask them to monitor themselves a little more closely and be a little bit more cautious about them being around other people where we don't believe they have COVID, but there's a chance that they could have been infected. But as we get to these lower numbers, an exemption for certain staff that are critical in order to keep the schools operating might be something that's reasonable. And I've talked to my deputy health officer, who's our medical director, Dr. Taylor, and we think that we can come up with reasonable metrics to work with you all on trying to keep staff in the classroom and as we get back into these, when we get back to numbers that are within these ranges that the state has recommended.
Yeah, Mr. Singer, I'm really glad to hear that we're making progress on that front, because that really was the sticking point for us while we were open in the hybrid model, was having to quarantine and contact trace on COVID-like symptoms. It just ballooned so quickly and caused a lot of staffing and logistical issues. So I'm glad to hear that we're making progress on that front.
And I do want to make it clear that we are taking a slightly greater amount of risk because we're bringing people back who've been exposed to somebody that had a COVID-like illness. And if the person is confirmed to have COVID, and that's where we're asking for cooperation of everybody to get people diagnosed as to whether they do rule it in or rule it out. If the person was confirmed to have COVID, we would still want to quarantine those teachers. But just with COVID-like illness, we don't think it's an unreasonable risk to the students or any of the other staff to bring somebody in as long as they're closely monitoring. And like I said, we're doing this in all other critical industries and other critical professions where we grant exemptions to certain critical workers. And there's no additional risk to the person who would be working. They're not sick at that point. If they were sick, we'd want them to stay home. So it's I want to make sure there's an understanding of what we're talking about here. And it's essentially granting the same type of exemptions we've been granting to other critical employees throughout the pandemic. And I think when we get down to the numbers that are in that range that the state's put in their recommendations, that it's reasonable to grant those type of exemptions. So if I get the next slide, please.
Hold on one second, Mr. Kyler, go ahead.
Yeah, one more question with that, and I'm not sure I fully understand, but when you say about ruling them out, is that's not with a test, that's with a doctor? And then also the CDC talking about shortening some of the time frames, is that something you're already working on, or is that something that might help a little more?
Well, let's, I know there's stories out there about what's been said by the CDC. I saw today where it says the 14-day quarantine period is still the best thing to do. We're going to look and see, we're looking to the state to see what the guidance is going to be for contact tracing, because I think statewide, we need to have a consistent approach to what we're doing with our contact tracing. So I don't want to go out and say the Carroll County is going to set a different standard. We're all working off the same contact tracing platform and the same policy. So I think we're going to take the lead from the state on that. There is some possibility that those time frames could be reduced, and that would be somewhat helpful. But the big piece is still coming back to what we're asking the help of the parents with and the help of the staff with is getting to a doctor and getting evaluated. Now that may include getting a test, and testing is we were backed up before Thanksgiving, and I was concerned that testing was going to be a problem. But I talked to our testing team today, and getting in to get tested is not a problem right now. We've increased our capacity. We're still able to get people in and get them tested within a couple of days. And our turnaround time, while it's not a day like it was before, 2 days is not terrible. So if we can immediately get people tested or have their doctor, because some people, it's going to be go to the doctor and the doctor's immediately going to be able to diagnose them with what those symptoms were and say, I can rule out COVID based on this without a test. So it's not, if that physician can rule out COVID, that's fine. The other option is having a test, and that can rule out COVID. So, either way is fine. But we want to give I like having people see their family practitioner, whether it's their PA or their doctor or their licensed medical professional, so that they can have that diagnosis made by them, have that discussion with their medical provider, and once we're comfortable that they don't have COVID, that gives us a lot more flexibility. So we really need the cooperation of people in the community and the staff, that if they're sent home sick and they're still going to be required to stay home until they've met that 10-day period or COVID's been ruled out, is to make sure that they're getting that evaluation done and not saying, well, just stay home for 10 days, because it impacts other people in the classroom and other teachers and things if you don't get evaluated and rule COVID out.
And Mr. Taglia, you have a question?
Just real quick, I wanted to ask, we have been receiving a lot of emails, preferably like say this week, regarding, how come private schools, they're not asked to close? Are they following this metric? So I kind of wanted to find out about that. If you can kind of just let us know and the public know, exactly, is the private school supposed to follow this, or are they doing something completely different?
Well, the guidance says that all school systems are supposed to be following. And now I got into a discussion. It says that it's required. It comes out from MSDE and MDH that this guidance is required for all school systems to follow. When we get into enforcement, is somebody going to actually enforce that on a school system? It's not my guidance. I didn't put it out there, and that's difficult. When it comes to enforcing mask requirements and other mitigation measures, we're doing that on a regular basis. But whether the schools are to close or not, with the private schools, the Secretary of Health wrote a letter to the health officers saying that they didn't want us to do that across the board with the private schools. So, I mean, this is the guidance that we've been given. It's the guidance that we're supposed to be following. I find it difficult to order the private schools to close because the Secretary of Health, who's my boss, wrote us a memo saying don't do it. So, I mean, it's from a public health standpoint, it would make sense that everybody would follow the same guidance. But from a practical standpoint, we've been told not to enforce the guidance on the private school. So I hope that answers your question.
All right, go ahead, Mr. Singer. Sorry about that.
Okay, that's all right. That's a tough one, and I do my best I can to answer it. The community COVID cases, we had 246 cases last week. As I pointed out, I said I think that's probably somewhat got to do with the capacity for testing as we went through the holiday. The total number of cases, we're seeing an uptick in the facility-related cases. Last week, our total number of cases was 318, and that's the highest we've well, not the highest that we've been out throughout the pandemic, but it's the second highest week we had, short of the week of the 15th of November.
And so, Mr. Singer, this graph is through 11/22. Do you have an indication of what you think the 11/29 numbers were?
So if you're looking at this, it's the week beginning 11/22. So that's
Week beginning
11/22
11/22, okay.
through that week.
Okay.
This week we're as of the end of yesterday, we were at 103 cases as of Tuesday for this week. So that is through the 29th, the 246 cases. Like I said, as of yesterday, we were at 103 cases as of 3 days into the week.
Okay.
And we had 71 cases yesterday. Does that answer your question?
It does. It does. Thank you. And I was basically trying, there's a lot of uncertainty behind these numbers, obviously, of where they're going to go. But if you look at a lot of the numbers that are playing out in Europe, we seem to be following the same trend, right? If you look at Spain and France and Germany and all those places, and you see their spike, we're following their spike. It looks a lot like a normal curve, and it's about 8 weeks from end to end, and it looks like we're actually kind of following the same pattern. So, and I think we can learn, or we can at least glean some insight from what's happening in Europe, and it looks like we're following similar trends here in the county.
And I will say that it's, one of the things that there were a lot of models out there at the beginning of the pandemic. I don't think any of the models forecasted us having a spike as large as the peak that we saw in the beginning of the pandemic. And there was always expected we would see a second wave. I think any of the models that I saw predicted that second wave would be smaller than the first wave, and it's actually not. So we're going to have to see where it goes, and I hope you're right, Rigby. I hope that we hit a peak and we can get back down to reasonable community spread numbers again, and get things back closer to normal. Can I get the next slide, please? This is the slide with those probable cases included in, and the probable cases actually, if you include those in our calculation, would actually have us at as of today 27.2 cases per 100,000 as opposed to the 22.3 cases per 100,000, and it just throw that out there for perspective to understand how that impacts those metrics that we're talking about if the probable cases were to be included. Next slide. There's a rolling average. Next slide. As I mentioned, we've seen an increase in deaths over the last couple of weeks. We had a total of 7 deaths last week, 4 the week before, and we've had 2 community deaths this week, which are things that we don't want to see, but they're not good for the community. Next slide. The ICU bed usage rate has been relatively stable over the last week. Next slide. This is where we get into looking at some of our age groups. Again, we had the highest number of the under 18 this week that we've had, other than a couple of weeks ago. I think they're comparable, but given the number of cases, we've got quite a number of cases in the under 18 population again this past week. Next slide. And as you can see, this slide kind of shows it pretty well that we had cases decrease in all the age groups except for the under 18 week over week. Next slide. Just to remind people to wear a mask when you're around people that are outside your household. Keep your distance from people outside your household. Wash your hands. Try to stay connected with people virtually. You can't say enough about the mental health aspects and whatnot, and trying to stay connected, especially with loved ones that are older and we haven't had a lot of contact with, and maybe feeling isolated. Try to do outdoor activities. Still been relatively warm, and maybe we'll get into the outdoor winter activities and avoid the large gatherings, especially with no masks and distancing. Last slide. Just want to invite folks to please take, we've got a survey out on our website, and what we're trying to do is to gauge interest in how many people in the community be willing to be vaccinated. I know there's all kinds of crazy stuff out there about vaccination being mandatory and things of that nature. I've not seen anything like that coming from any official source that that's going to be possible. So we want people to get vaccinated. I plan to get vaccinated when it's available to me. But what we want to know is whether people are going to be willing to get vaccinated or not. That'll help us in our planning for looking to the future. And it's going to be several months down the road before vaccines available to the general public. But we want to be able to plan for how many people we're going to need to vaccinate and plan for how that's going to be done. So if you could participate in our survey, we'd greatly appreciate it. And that's all I have. I'd be glad to entertain any questions that anybody has at this point.
And Mr. Singer, on that last point about vaccination, is there, I know that the prioritization is going to be, medical healthcare providers first, then the most vulnerable. Is there any discussion about, teachers and school systems in terms of like high risk individuals who may be on ADA leave or something, that they would be able to be in the front line of the vaccinations if they were willing?
So there's all the plans that I've seen have had educators and folks like that in the second phase. That would come behind first responders and frontline healthcare workers and things of that nature. So I don't know when that phase is going to hit, but the teachers are a higher priority than the general public.
Board members, any questions for Mr. Singer on any of the slides? Or do we want to open it up for discussion? Because this was the meeting, the reason this meeting was set up was to reevaluate, look at where the numbers were and what potential decisions we would need to make from an opening perspective.
I have a question about our dashboard. I saw emails the last couple of days saying that it's not being updated. That's not correct, right? I mean, it's ongoing, and the state site that shows the outbreaks, it's all ongoing. It might have lagged maybe over Thanksgiving because people were off, but it's current, right?
Well, as I had said at the end of the last meeting, our dashboard, when we don't have all the students in, there is a pause to that. We are still monitoring all the programs we have going on, but we can't. So some of our special ed programs might be less than 5 kids. For personally identifiable reasons, we can't put a dashboard up for a specialized program where there might be 3 students. However, we are still following, and Mr. Singer alluded to the fact that we are still contacting, obviously, staff, parents, whenever there's a COVID-like illness, whenever there's a positive case, whenever there's any contact tracing happening. So we did pause our own dashboard only because we also now, because we don't have students in the hybrid, it's a little more challenging to try to keep track of them when they're not in our buildings. So.
But now an outbreak would still go to the state?
It still does, correct, if it's a program still running in our schools.
Yes.
So I guess this is, just a couple of additional remarks where, we're getting tremendous pressure from the public to open up the schools for their students. And you're seeing a lot of stuff out in the public as well, right? You've got Fauci making announcements saying, open the schools. You've got CDC, revising their guidelines. You've got announcements from the 7 New England governors saying open the schools. And it's bipartisan efforts throughout the country going on right now. But our numbers are not at the point where we're within the state guidance. And that's where it becomes difficult. But if we have seen the top end of that peak, and we are indeed on the downward trend, then it is possible that we'll be under the 15 within the next couple of weeks as we approach the holidays again. I just want to open it up for thoughts from board members. I mean, we had set this as an evaluation date. I don't think anyone is advocating at this point for opening up now, simply because the numbers are outside of the state guidelines. Am I incorrect in that understanding? But if we want to talk about potentially setting a target date, like we did with the October 19th, we basically said if we're within the state guidelines at that point, we were going to open up on October 19th. If we want to take a similar approach to saying, okay, well, shortly after the new year, as we're coming back in, do we set a date in January to say if we're within state guidance that we would open on? I originally was thinking that I would throw a date out there of January 4th, but Dr. Lockard, you were thinking maybe the 7th, if you had a recommendation of the 7th might be a better date, because we'd be coming off of a 2-week holiday. So to start at the first day, that might be a little bit of a struggle to start on a Monday, but if we started on Thursday, that would give everybody a couple of days to kind of get back in the swing of things, make sure everybody understands where we are and what we're doing.
Yeah, I would agree with that. Again, assuming we're within the metric, under 15 new cases per 100,000 per day and under 5%. I also think it might behoove us to sort of reassess with our parent community. I know nobody likes surveys, and Mr. Singer just sent out a really important one that we also advertised for him about the vaccination, but it might be a good idea for us to get another gauge. Most of our families had the opportunity, at least to some degree, to consider the hybrid model that we were in for a while, to ask, okay, if we get within the 5% that the state recommends and we get under 15, would you be willing to continue to send your student into the hybrid? I think that's just good information for us to have. And I do think, let's just say we are under 5 and under 15, we'd need just a couple of days there after that winter recess to be able to make sure we got all of our buses picking up the right kids and staffing and et cetera. So obviously we work on that all the time. That's all we did while we were in the hybrid. But that would make the most sense to me from a logistical perspective.
Okay.
Dr. Lockard, if I could just chime in here real quick. I also think the 7th makes more sense because if we get to those metrics, then going back right after the weekend, because the biggest risk for spread we're finding is about 5 days after exposure. So by the time the 2nd rolls around, everybody should have finished their traveling by then, and at least gives us 5 days for people to potentially develop symptoms or and whatnot, and maybe we wouldn't have as much asymptomatic shedding of the disease.
And I like the idea of reaching out to the community again, right? The last time that we surveyed was in August, and we've learned a lot since then, and a lot of situations have changed, right? We didn't really know how enhanced virtual was going to go. We didn't really know exactly how hybrid was going to go. We've learned a lot in the meantime, and I think it would make sense to reach back out to the community to say, okay, if we're within the state guidance numbers come January 7th, would you be sending your child in hybrid? And I would actually throughout, and depending on where those numbers come out, we might want to also ask if they would send their children back, if we would do 4 days a week, right? Because depending on the splits, if only 50% of the families are sending their kids back, then we wouldn't necessarily need to split up A and B cohorts, right? If we're already at 50%, then we might want to consider doing the 4 days a week for the kids who did want to come in person. So would it make sense to reach out in the survey saying it both ways? Look, if we were to open 2 days a week in a regular hybrid, would you send your child in person? Or if we were going to open 4 days, would you send your child, to kind of get a gauge of where the community is? Does that, oh, I'm seeing yellow cards coming up all over the place. Okay, so, Ms. Herbert?
Let's think about the date first, and I'd like to make a motion that we go back to hybrid on January 7th, according to the wishes of Dr. Lockert's metrics that he
Right, so,
announced.
They're the state's metrics, not mine, right?
no, but the recommendation of the 7th, I think, was a joint recommendation from Dr. Lockard and Mr. Singer, that the 7th would make sense if we are within the state guidelines of the 15 per 100,000 and 5% positivity.
I don't think, why not the state guidelines as they exist at that point in time?
Okay, yes.
Yeah, I don't-
Okay, so then I need to read them. Oh, I'm sorry.
Okay, we didn't second that motion, so why don't you restate your motion and then we'll get a
All
second.
right, I'm going to make a motion that we open hybrid on January 7th, meeting with
According to these, as long as we're within the state
State
guidelines
guidelines.
at that point in time.
Yes, there we go.
Do we have a second?
I will second that, as long as we're saying, again, if we meet the metrics at that time, if
Okay.
we're able to open on the 7th, yes.
Seconded by
Second that.
Dr. Dorsey. Okay.
And the
So-
reason I wanted to do this was because I wanted to talk about the date, then we can do the other
Do
parts.
the other pieces.
Yes.
That makes sense. Okay. So we have the motion, we have the second. Dr. Dorsey, did you have some comments you wanted to make?
Yes, I just wanted to add as a part of the discussion, since we have it on the floor, that again, we are certainly concerned about short-term, doing things like every week or every 2 weeks. So again, this sort of sets the stage for where we will be now through the holiday, and then how we would start at the beginning of the year if the metrics would allow that. So again, it would give the parent community, the students, and the staff some time to know that, okay, we'll be in virtual until this time, so they can plan accordingly.
Mr. Carlo, did you have additional comments you wanted to make?
I'm not sure. Again, I wish we could open next week, and we do need to talk and plan ahead. And, I'm looking, and the trouble is, I guess, if we don't do something today, and we come back and we meet on the 9th, and somehow the numbers are down, we're pushing it, it's not even 2 full weeks. So as much as I hate this, maybe it's the best option.
Ms. Eisenberg?
And I'd just say, even if the numbers dropped off significantly, there's no way by next Wednesday that we're going to be at a point where you're going to be down less than 15 per 100,000. I mean, the cases would have to completely drop off the table to the point that we're virtually seeing no spread for that average to get to where you want it to be.
Ms. Eisenberg, did you have a comment?
Yes, I do.
No, I don't mind being bossed around, thank you. Yes, board members, if you're talking about opening on January 7th, based on the metrics, on what date are you looking at the metrics? You wouldn't be looking at it on January 7th to open up on January 7th. So what date would you be looking at?
Right, so we get constant updates from Mr. Singer, usually daily, but we also get a weekly report. And so we would need something heading into really the week prior, I guess. Mr. Singer, as we think about sort of advance of January 7th, the week prior is December 31st, December 30th, I guess, is the Wednesday prior. Would we be able to expect a compilation of the cases for that week, the week prior from you and your staff?
Yeah, you guys are going to get a weekly report from us every week, and even the week Christmas and New Year's and whatever, you're going to have the information. So, I mean, you can take a look at the trends and see where you think things are going, and we can certainly have discussions informally, unless you feel like you need to have a board meeting.
Right, and so we do have a board meeting the following week, on the 13th. So we would know the week before the 7th and be able to communicate to families one way or the other. And then a meeting the following week. Sorry, Ms. Herbert.
Okay, so Dr. Lockhart, I'm sorry, you were saying the 30th,
Yeah.
that we would have a quick discussion based on the report from that week and make the call.
Yeah, I think to answer her
7th.
question, the decision will be
that-
made on the 30th.
The decision will be made on the
Does that-
30th to
does that
open
sound
on the
fair?
7th. Okay.
Yeah.
Might I suggest that we might wait until the 6th of January before you look at the metrics? Because if you're looking at the 30th, you're not even a full week beyond Christmas for those metrics. All the information I'm getting saying that the numbers will spike within a week to a week and a half or 2 weeks after the event. So if you wait to the 6th, you already said that you possibly would go back to hybrid on the 8th. If you look at the 6th, you have the numbers there from that time, and you can make a decision on the 8th from the numbers that you get on the 6th. Just my suggestion.
Well, it would be the 7th is the date that we're talking about, the 7th. So looking at it at the 6th, I think is too late.
Yeah, you're right. I'm sorry. You're right. I was thinking of the 8th instead of 7th. You're absolutely right. So maybe go to the 5th then, so you have 2 days to look at it. My mistake on the date.
We could, Ms. Herbert?
Does Mr. Singer give us the numbers on that Monday?
Marcia, I'm sorry, can you turn your microphone
Yeah,
on?
I'm telling you, January 4th, doesn't he usually give us the numbers on Monday?
We would have the numbers, I think, on the 4th, so we could potentially
Yes.
discuss it that
I
evening.
I think we need to look at it on January 4th.
On the 4th. So,
Yes, sir.
Mr. Singer, I see your hand up. You'd be able to give us the prior week's numbers on the 4th, correct?
So I'm giving you guys an average positivity rate and a average cases per 100,000 every day. So I mean, you're going to get those two numbers every day, and those are the key numbers that the states base their guidance on. So you can look at those numbers every day that I give them to you. You're going to have them every day.
And I do appreciate getting those every day. Thank you, Mr. Singer. So why don't we do that then? That's a good suggestion by Commissioner Frazier. Let's, if we can do it the evening of the 4th, we'll look at the most up-to-date numbers that we have on the evening of the 4th to make the call for the 7th. It's going to be the 7th if the numbers are in, and we're going to use the date of the 4th to evaluate the numbers. Ms. Pataglia?
I was going to see if Devanshi had any comments, students' perspective, to see what her thoughts were.
Well, the biggest thing that I've heard from students is that the lack of consistency and continuity over the past month has been really harmful to them. Overall, student morale and mental health is currently very low. And I think that maybe we could even try to look at student grades. I've heard from many that they have been on the decline as of a whole. And ways that we can try and improve that even if we stay in virtual. So my only consideration for January 4th is if we do choose to go into hybrid and then suddenly maybe 2 weeks later we go back to virtual, it's harmful for students and it won't benefit them in the all. Of course, the hope is that whatever decision we make then we're able to stick with it. But I guess just the continuity for the students is the best right now, and like aiming for that continuity and just making sure that the students get the mental health support that they need, even if we do stay virtual. And that support for their mental health can come in like many different fashions. It can just be like changing up certain aspects of the virtual model, but so it doesn't necessarily have to be that. It will just be if they go into hybrid that their mental health will improve.
And I think that's a very good point. I'm sorry, Ms. Battaglia, you looked like you wanted to respond.
No, I just wanted to tell her thank you so much for bringing up the mental health piece. I know that's something that we also have been hearing a lot about regarding students' grades, the decline of, wanting to be involved in school. So Da Vinci, I do appreciate you bringing up a lot of that important perspective that we really needed to hear. I do appreciate that. Thank you.
Dr. Lockard?
This was about the 4 days a week, so I'm going to table that
Okay.
conversation until we finish the,
Mr. Kyler, you look like you're,
No,
Oh,
I'm
okay.
just sitting here thinking, so we're physically going to meet on the 4th?
I think that we need to have a meeting of some sort. I'm not sure if it needs to be in this room, but we would have to at least have a virtual meeting to discuss.
Yeah. Yeah, I mean, there's too much gray in all this to just think it's just going to flip and happen.
Mm-hmm.
So we can schedule a virtual meeting or another update meeting for the 4th. We'll have Mr. Singer's data and take a look and see where we are as it relates to the metrics that we've said we need to meet, and go from there.
Board members, any other comments on this particular motion? No, then I will call for the vote on the motion as restated. Can I get a verbal aye, please? Aye.
Aye.
Any opposed? Okay, that passes unanimously. Thank you. Okay, now do we want to talk about additional aspects of the January 7th potential opening in terms of, so are we all in consensus that we want to survey the community? Oh, Ms. Herbert, you, no? Okay. Okay. Mr. Kyler?
I question that. The last survey, we totally ignored the results. If we do a survey, we've got to step up to the plate. And if we put on, and we need to talk about that, if we put on 4 days, if we put on whatever, and that's what the majority wants, if we're going to do a survey, then we need to follow it. And I don't care if we do the survey or not. It's, again, we're a representative form of government. It's not all popularity, but I just feel like the families have been told since summer that it didn't matter what they said, and we need to make sure we honor it if we're going to do it.
Ms. Battaglia?
I would think it'd be more, again, of kind of like a re-register instead of a survey. You know what I mean? And instead, this way it's, yes, I'm going to send my child back. No, I'm not going to send my child back. So what we originally had wanted back in July to get actual figures, numbers, set the stage for the classrooms, I think that's what that's what we need to let the community know. It's more of another re-register in a sense than an actual survey.
Dr. Lockard?
So as I think about that, then maybe that's not necessarily a survey. The reason I put my card up a while back is, and then also to your point, Mr. Kyler, if we say, would you send your child 4 days a week, if we were able to do that, I immediately start to think about, okay, can we meet the social distancing guidelines that we're required to meet? Can we meet the guidelines for how many kids we'd put on a bus or can't put on a bus? Do we have to make people then commit one way or the other for a longer period of time, because let's say that, you know, you name the school only has 50% of its kids deciding to come back in hybrid when we get there. And then as a few weeks or maybe a month go by, we're seeing, you know, rates going down and vaccine distribution kicking up, and all of a sudden more people want to come back into that 4 days a week. Of course they would. But has the state changed has MDH changed their requirements of us? Can I say, yeah, sure, we got plenty? If they're currently the same requirements, I wouldn't be able to, in terms of social distancing and the space I need. And then I'd be doing exactly what you said we don't want to do, which is say, you know, do you want to come back? And then we say, well, you can't. So I'm just throwing out kind of trying to think through it. What would that mean? What would that implicate? And would we be able to follow through with that?
Right, and I guess I was just thinking that the rationale behind the cohort A and the cohort B was because if you assume that everybody comes back in person, that cuts your numbers in half, right? So that you have half the students coming in on A and B in order to meet the social distancing guidelines. But if you're only having half the people, like if they have a choice between virtual and in-person and only half the people elect for in-person, then you don't have to split those into an A and a B cohort. You have the social distancing that you need because only half the kids are coming back. So I thought that it would make sense to try to get a gauge from the community whether their answer would be different if it were 2 days versus 4 days. But I see your point, Mr. Kyler, certainly about, well, we don't want to get hopes up if it's something that we can't actually accomplish.
We also have to remember that since we have been supporting our teachers during hybrid by granting access for their children to go 4 days a week so that they can teach for us full time, that has created many classrooms that are much more full than we originally started with.
But I thought we only had maybe 30 teachers take us up on that.
We started with having 30 teachers take us up on that, but then it grew. It grew to other teachers and it grew to other staff.
Can I just want to chime in with a thought on this, and I shared this with Ms. Savigny earlier, and that is the one concern that I have is it does put us in a little bit more of a risk. The reason we split A and B the way that we did, you know, Monday and Tuesday and Thursday and Friday, was that if we did have kids that were sick and potentially infecting other kids, we could sort them out, because you'd have a week, well, you'd have 6 days between the Tuesday and the next Monday before that cohort came back. You have them going 5 days a week. It kind of defeats that portion of the purpose of the hybrid. And I'm not saying that you can't do it. I just need you to realize that it does increase the risk of transmission in the schools, because you are having the same kids going 4 out of the 5 days a week, and there's no real break there where you can try to look at whether or not kids that were sick might have transmitted to other kids, and who you need to quarantine and who you don't need to quarantine, and that whole model might look a little bit different with the same kids in class the full week long.
No, and I understand that, and I'm not saying, like, so if 80% of our population said yes, I would send my kids in person if it were 4 days a week, then we wouldn't be able to meet the social distancing guidelines by sending them all 4 days a week. But if 50% of the community said I would send my kids 4 days a week, then we would be able to meet those social distancing guidelines, right? So I'm not saying that we compromise the social distancing guidelines. I'm saying we get a handle on what those numbers might actually be. Mr. Kyler?
Well, yeah. My concern is, and you guys can clarify it for us. It just seems it may be great. I just wish we could say 5 days a week, everybody, but we can't yet. And my worry is what do you do if the high schools, it works great, but the middle schools, it doesn't? You know, I just can't imagine that K through 12, it's going to work out that we can do it 4 days a week. And I just think we're setting ourselves up to again say, never mind. You know, I think, and everybody's hollering, rightfully so, that they want consistency. And I'm not sure. I think if it's going to be the 7th, and it's got to be hybrid, and we get them in there, and then we see what's going on. Maybe, you know, you can always make it more, but it's like starting out easy and trying to be more strict. You can start out strict and back off a little bit, but the other way's hard, and it just worries me that, and like Ms. McCabe said, if it was 30, 40 families, if they're all elementary kids, that's a big impact. If they're spread, you know, nothing's spread out equally over the whole thing, and that's what worries me about it.
And Mr. Kyler, just to that point, you know, as you said, it may look different at high school than at middle and elementary, and it could even look different from one elementary school to another. We may have one elementary school where you know, not many parents want to send their students back 4 days a week, but we could have a very high percentage in another school that would make it impossible at that school. So while I get excited about the idea of having students back 4 days a week, I think it would be difficult to do it in any kind of consistent manner for all of our students.
Dr. Dorsey?
I was just going to add, I don't think we should be offering an option if we really can't accommodate it. Again, it sounds great, but again, if people say, yes, I want my kids to come 4 days a week, and then we come back and say, well, sorry, we're not going to be able to accommodate that because we still need to maintain social distancing, and, you know, we just can't accommodate it. So I would not like to offer the 4 days at this point. I mean, I think we need to say, okay, you know, if we're going to be going back hybrid, we would structure it the way that it has been structured with our A days and B days, so we can maintain what we need to as far as the social distancing is concerned.
And if I can say just one more thing, Dr. Dorsey, you made me think of this when you were talking A and B. We've also got to consider for the future, for a while, we're still going to have people that opt for virtual only. And what happens if we start changing days around? What does that do to their schedule? I just think there's a lot of factors in this that we got to be cautious we don't offer more than we can give.
Okay, so are we going to do we want to survey at all?
Is there a
Yes.
motion on the floor?
There isn't. We were discussing.
Yeah, you need to have a
Right,
motion
you
on
need-
the floor to continue this.
Okay, so does someone want to make a motion for whether we will survey or not?
I'll make the motion
Which way?
to survey families if they would like to have their child continue the 2-day hybrid or not. Like a re-register, per se.
Okay, and I will second that for discussion purposes. Okay, Dr. Lockard?
So as far as the re-registering goes, Ms. McCabe, I'll need your help here, but last time our schools reached out to all the families to ensure that they knew exactly who was assigned to what cohorts and registering, if you will. The survey would more or less just get a renewed gauge, is what I'm getting from the board, that once we meet the metric, January 7th, are you choosing to send your child in the hybrid to school 2 days a week? Correct? I just want to make sure I understand what we're asking for the survey, and clarifying schools would again reach out and re-register, if you will, who's coming on what days, correct, Ms. McCabe?
Yes, it would be like the last survey that we sent. That survey asked if they would be sending their students to school in the hybrid version, and it also asked about whether they would be using bus transportation to do so.
Okay, so it wouldn't really be a survey, it would just be a re-registration, because there was a lot of movement with things happening over the last couple of months of people switching in and out of hybrid or virtual. So it would basically just be, please re-register for your desired option come January 7th.
Yes, and it basically explained that the re-registration process was just for our planning purposes, so that we could make sure that we had students in the correct groupings, and that we had the sizes of the groupings correct, so that we could have appropriate social distancing.
And I don't know whose card was up first. Tyra was up first? Okay.
I was
Ms.
just saying
Battaglia.
that, I mean, if just redo what we did again, I think that'd be perfectly fine.
Okay. Dr. Dorsey?
And I was just going to say that the last time, again, parents could change their minds no matter what they chose, right? So are we going to give the same flexibility with this new re-registering?
I'm gonna say no. I know, I think we saw a lot of emails where it was a lot of kids jumping back and forth, and that can create some issues, and I'm thinking it needs to be, you're gonna do what you stick to saying what you're gonna do.
Mr. Geiler? Oh.
Yeah, and I wondered, can we do that? I mean, they can change anytime they want, and we can't stop that, can we? And then second question, Dr. Locker, before you say that, does it help you if we do a quick survey, or should we just let the principals do what they did and let that be the results we see and not do a survey? Just let them register.
So I'm starting to think the latter, and I'll ask Ms. McCabe to talk about what is most helpful to principals, because we'd have to do both. We'd have to survey, and then we'd have to say, okay, principals, reach out to your parents and make sure you know who's coming on what days and who's not. As it relates to the options, so it's a double-edged sword. I want that flexibility for our parents and our students to be able to say, yeah, either I'm not comfortable and so I'm going to stay all virtual, or for whatever reason it is, or maybe it's, okay, now I'm able to send my child 2 days a week, and I want to be able to not be locked into something for, a period of time. It's challenging at our schools if it's happening on a daily basis for our teachers especially. One day somebody's here, the next day they're not, next week they change. I almost wish we could maybe have some sort of period, if you will, where you got to commit to a certain point, and then we'll have another a time where, if there's any changes, you can do it by this time, and it starts on this day, as opposed to just any day of the week.
Right,
'Cause
you have some flexibility, but not completely fluid.
Right, because that's really hard on the teachers.
Ms.
You
Herbert?
know, what might be helpful for principals is just to keep as much consistency as possible with who was in what cohort before we went back to virtual. So we could just have principals reach out to each parent and just confirm that when we go back to hybrid, that they will be sending their student back. We could make it as simple as that.
Ms. Herbert?
That's what I was thinking, Ms. McCabe, because to me, this looks like this is just double work. They've already decided. I think what we need to get a hold of is them jumping every other day. We all, they were in hybrid, or they were in virtual, and I think what we need to do is pull in the reins that they can't jump every other day. I think that would make more sense than doing another survey. I just think that's just double work, and it's going to be a waste of time, because we still allow them to move from one to the other. I think we need to set up a parameter of, once we get back, you have so many days or whatever that's not the discussion right now, but I say no to do another survey or a questionnaire, because it's just, it's been done. You guys have done all that work. You don't need more.
So that we're saying, don't do a survey, but we would, just because there has been a lot of movement and change, it, just making sure everybody has declared what their true intention is as of January 7th. So basically redeclare, right? Like, so the system will be open, and if you want to change your mind, like, so how would that be executed?
So I think we would just reframe, the board decided if the metrics fall in what we agreed upon, that we would re-engage in the hybrid, or when they do, we will re-engage, but January 7th would be the earliest. We want to validate or make sure everybody's staying with what they had or not, let us know, so that principals have time to get a gauge on that. Cindy, anything else that we would need, and we'll work on this and work with our principals to make sure we capture all the correct information. I think that would be enough for principals to go, okay, just about, I mean, my guess is there'll probably be a lot of similarities. People will typically stay with what they had decided, but there'll be some changes. And then I think we can look at, here's the window if you want to switch. It can't be tomorrow or, day to day, but we need some advance notice. And so we'd have to work with what's reasonable. Is it, you got to give us 2 weeks notice if you're going to be switching from virtual to hybrid or hybrid to virtual. I'm just using that as an example, but it just can't be one day to the next.
Okay.
Exactly, because what I was going to get to is because our educators have been very gracious. Oh, you're in class today. I didn't know you were going to be in class today. Thank you, Johnny. Thank you, Susie. And I'm glad you're here. But we can't have them jumping every other. That's not fair to our teachers in front of the class or doing virtual or whatever. That's not fair to them to be going back and forth, and I know they have. So I think we need to set something else up for that.
Okay, so the motion was on the survey. It sounds like we're no longer in favor of that. Let's take the vote on the survey to officially vote that down, and then we can talk about the revised recommendation. So I will call for the vote for those in favor of the motion regarding the survey. Can I get a verbal aye, please? All those opposed, can I get a verbal nay, please?
Nay.
Okay, that vote fails by a unanimous vote of 0 to 5. Ms. Herbert.
Well, I'm tearing it up tonight. I've been a motion queen here. I'd like to make a motion that we set a parameter for students to be allowed X amount of days to change, but then they need to stay. I don't know how.
Right.
How do we word that?
Can I ask Dr. Lockard to make the recommendation of the best way to affect that?
As he administers the schools.
Exactly.
Well, and I'm going to ask Cindy or the directors to jump in too. I think we still want to have some flexibility, because this is an ever-evolving, ever-changing thing. So I don't want to lock everybody in. I think we've been the opposite of locking things in. Maybe that's been a little bit of a challenge, but we need flexibility. And so we know it can't be one day to the next. So what's the most appropriate and still provides flexibility, but isn't, so challenging like a day-to-day thing. I'd thrown out, give us 2 weeks notice. Is it 3 weeks? Cindy, I want some principal perspective or directors to chime in here. What makes the most sense?
Yeah, I think, giving a certain amount of notice is good, but I also think we should lay out a parameter for how long they have to stay in whichever structure that they've chosen. And, that is probably best done by directors talking with principals, and getting a feel for what is most helpful and doable for them.
Mr. Kyler?
And I wanted to, and you helped me by leading right into it, I think. We are meeting next week. maybe some of these details, do we need staff and directors to talk amongst themselves and not nail, again, like we talked about the survey, let's not nail down stuff tonight that we're going to regret next week. Give everybody a chance to plan it out. You okay with that?
I'm perfectly okay with that. Thank you.
Okay, let's do that so that we will have a COVID-19 update section on the agenda for next month's, or for next week's meeting for December. So we should put that on as an item up for discussion. And that'll give you some time to craft a recommendation that you're comfortable with.
So do I need?
Ms. Herbert?
So do I need to?
Rescind that, or we didn't get anything
You never
done?
got it on the
Okay, never
floor.
got it on the floor.
Never got it
Okay,
on the floor.
Good, okay. All right, can I make another motion?
Go for it.
I'd like to make a motion that we start sports on December 19th.
19th?
I mean, December 14th.
14th.
14th, right. I even had my calendar out to even look at it.
Okay. So,
Because I think that will be in line. They can practice in small groups. We bring people back.
hold on, make your motion again.
I would like to start athletics on December 14th.
Do we have a second?
Second.
Seconded by Mr. Kyler. Okay, Ms. Herbert, now you can,
And the reason I'm looking at this, because it's a progression, and it'll be small groups. And then when we get back into January, if possible, and we get our schools open, then they will be ready to play. I'm just looking that they've got to get X amount of days in to practice. I know that. That's a state rule, so. And I think we've done well with our safety and our protocols in the fall for all of our sports activities and conditioning.
Ms. Pataglia?
I was just going to ask, does that include other extracurriculars such as band, cheer, chorus, dance, theater?
Have they stopped? Small groups?
No,
Okay.
I don't think so.
Well, that's just that we needed to have a start date for. Yeah, MPSSA, not for, because I thought they were still, we didn't stop any of that.
Right, that's all still.
Right, yeah, that should all still be going, because we didn't stop small groups of anything.
No, I just wanted to make sure.
No, no, I knew at MPSSA, we needed to have a start date. Right, Mr. Duffy?
That is correct, Mr. Herbert. There is a 20-day rule for the MPSSA before a game could be played.
And the December 14th date does not impact the rest of the seasons, correct? They're still able to get in a full winter season and still, because originally we had said December 7th, now it's December 14th, but that doesn't impact the rest of the downstream schedule.
No, ma'am, that does not impact when the first game could be played.
Okay. Mr. Kyler, you had your card up?
Yeah, I just wanted to reiterate, you told us that last week, that originally it was supposed to be the 7th, that was the statewide date. You recommended the 14th and said that would not impact. And I think with Mrs. Herbert's motion, if we don't do something, then if we don't watch it, it impacts the other season. And then my only question, are you hearing much from the rest of the state? And that doesn't change my opinion on this, but will there be postseason tournaments, or nobody knows yet?
At this point in time, the only school system of which I'm aware planning on starting in December is Frederick County. And having spoken to people across the entire state, that's consistent. The private schools are meeting now to talk about, they're having a vote this month about starting in January. I see Mr. Frazier nodding, so I know I'm on board I'm spot on that one. That's good to know. And additionally, the school systems who started with the October timeline, both Garrett and Allegheny they have a meeting next week, but they're not anticipating returning until January. And the other school systems, no one has indicated. The other school system who was likely to start early was St. Mary's County, and they announced yesterday they were going to be waiting until January. So almost no one is planning on starting in December due to the positivity rates, the numbers per 100,000, all the metrics that they're seeing.
If I can jump in here, because I don't have a yellow card. Ms. Herbert, are you saying start on I can't remember the date, like you said, the 14th, but is that regardless of let's say the number of cases per 100,000, or just, because I think if you want to start on 14th is great, but I think you have to take into metrics in consideration, because if they're not favorable, if they're going up, or if the number of per 100,000 is over 15, I just think that's problematic.
I consider that a small group activity.
I feel like it's synonymous as well. Like this is really a limited in-person program, right?
Absolutely.
No, and if is it okay for me to chime in, because I don't have a yellow card either?
Go ahead, Mr. Singer.
I shared last week that I had concerns about this. I mean, I know, and Mr. Duffy referred to. I called my colleague in Frederick County. I said, "What are you guys doing?" And they're talking about having cohorts of 3 wrestlers or less that have to stay with each other throughout the whole season, and that's it. And having absolutely no contact on the basketball court with the practices that they're planning, and this seems very limited to me. But I guess something like that, you could consider that to be a small group activity. I just don't know how that gets you to the point where you're having competitions, if that's what your goal is, because but I wouldn't advise it either way. I think that if we're not at a place where we can go back to school, I don't know. I get you saying that it's a small group activity, but we're talking about wrestling having physical contact with each other. Most of the small group activities we're trying to keep people socially distanced. And I don't know, I talked to Mr. Duffy and I said, even, Frederick County wearing masks, that doesn't necessarily, while I think that might help with transmission, I'm just a little bit worried about that in wrestling. I could just see that getting caught on somebody's hand or something while they're trying to do some type of wrestling move and get wrapped around somebody's throat. And I just, I just frankly say what I think. I don't think it's a great idea. Well, I don't think it's a good idea, but ultimately it's your decision. And I've chimed in. I said my piece, and I just don't think this is a smart thing to do.
And board members, I see that Devanshi has her hand raised. Devanshi, did you want to say something?
Mr. Duffy, if we do start in January, then would we still meet the 20 days for competitions or not?
I met with the athletic directors just yesterday, and we did have that discussion. If we were to start on January 4th, we could have a period of time for a season after the 20 days. That is correct. We would get about a 3-week season, which could be up to 8 basketball games and 6 wrestling matches. We could get that in if we started on January 4th. I think one of the things that I would look for some guidance if Ms. Herbert's motion moves forward is, what are you looking for with an athletic program? Are you looking for us to begin on the 14th with full-on tryouts preparing for games on January 4? Are you looking for us to begin, as Frederick County is doing, as Mr. Singer mentioned, with sports, with skill-based program? Or are we looking for something similar to what we did in the fall with our return to play program? I appreciate some guidance on what you want, and we'll have a plan drawn up for next week that meets that for which you're looking.
And board member, so I guess we should decide on whether the December 14th date is what we want to go with. I mean, did we have any more comments on that? And then we can decide what it looks like. I mean, I'm in agreement with you, Ms. Herbert, about it's very similar to small group in person. And to Devanshi's point about, the mental health of the kids, like when we make a statement, then we yank it and pull it away. I feel like we're in the same situation if we yank sports again at this point. And I think by viewing it in terms very similar to limited in person, that we can get comfortable with that, or I can get comfortable with that. Board members, I don't.
Dr. Dorsey.
Dr. Dorsey, you have your
Well,
card up.
I just have a question, because I think too that before voting on this, I'd like to know what we want it to look like on 12/14. I hear you saying small groups, but again, exactly what are we saying that it will look like?
Well, the first thing I think we had to decide whether we want to do sports starting on the 14th, and then we need to figure the rest of it out. But I'm telling you, mental health is a big thing, and I am telling you, these high school students need something, and they definitely, high school sports is a big deal to some of these athletes, and they need to be doing something besides sitting behind a computer or worrying themselves to death. And I think this is a step in the right direction for mental health.
And Dr. Dorsey, you're saying that you don't feel like you can make
I'd like to vote on it, knowing
vote
exactly
until
what
you-
I'm voting on.
so you understand what it would look
Right,
like
what it
with a
would
December
look like.
14th start date.
Right.
Mr. Kyler?
Dr. Luck, your card isn't up. Is your card up? Okay. If you had it up and, I didn't want you to look evil at me. Isn't there a return to play plan that the state had that if it would have started like planned December 7th, what they would do? And I know, I'm not that familiar with what they do, but I know, again, on the rec sports level, for instance, wrestling, the kids walk in wearing a mask in the room. They don't wear a mask. They keep them in groups of, I think, 3 or 4. They don't go around to different kids like you normally would do in a practice. Basketball, I can't speak for, but again, there's only 5 on each team on the floor, and what I've heard is coaches wear a mask, parents aren't allowed to be there, no spectators are allowed to be there, they limit the numbers, and they spread the kids out. Most of the high school wrestling teams, and Mr. Duffy, I don't know if you have an idea, back when, before the pandemic, a lot of them didn't have more than about 25 kids. And I just thought there was a return to play program that had all that. And again, like a couple of the others have said, I just feel like it's time we've got to do that stuff. And again, and Mr. Singer, have you seen any cases contributed? I mean, basketball's been going on all summer. They stopped their groups of 3 for a little bit, but they're still practicing and playing. Wrestling's been going on all summer, and practices for the typical season have been going on for well over a month. Have we seen any problems?
So you asked the question, and we've had significant outbreaks that have been more related to, I think generally, it's hard to say exactly what they're related to, but I think they're more related to team bonding type activities than they are to the actual participation in the sports. But we've had some fairly large outbreaks among sports teams, and I think it's been more related to essentially folks not following distancing rules and things of that nature. It does concern me with direct physical contact that transmission is. There's no way to stop that. If you were to limit it to the small groups like we're talking about of maybe 3 people, I guess that'd be less concerning. I was concerned about, I'm just trying to imagine a wrestling room where you got 40 kids and you put them all in one room. I can't imagine that they wouldn't all be in close contacts. But Mr. Duffy says there's other ways that y'all intend to work around that. While I'm really concerned about where our community transmission rate is right now, with almost any activity we'd have, we have seen outbreaks that, whether it's, I don't want to say that it's directly related to the play of sports, but it's been related to the team type activities.
The parties.
I can't say that for, I'm not going to say that it's for sure the parties or for sure it's the participating in the sports. I tend to think that it's probably more of that type of thing, team bonding, but I know can't say that there is no transmission on the field. We've seen it amongst teams, and exactly whether it's caused by what's happened on the field or what's happened off the field, it's hard for me to say.
Ms. Herbert?
I know that you've got, just like Mr. Kyler said, you've got 5-on-5 in basketball. I know you have to have more than 10 players at a time, but I know for basketball, there's at least 6 baskets in every large gym, and I know some schools have up and downstairs, or they have large gyms, and you can definitely social distance during basketball. That is not a problem. Wrestling, I cannot answer that. But Mr. Duffy, the state doesn't have any guidelines whatsoever to start?
The state has, the state makes recommendations with regard to utilizing the National Federation rules and play modifications. As far as starting, no, that's obviously up to each local school system who determine where the local boards will, or designees determine which sports will start. That's really at this level then. One thing I do want to distinguish and differentiate for, just to be clear, is I understand that athletics would be for the most part in small groups, but I don't want people to get the idea that an athletic small group is equivalent to an academic small group. I think in an academic small group, students are socially distanced in a classroom, not doing a lot of things directly in each other's space, whereas an athletic small group, it's obviously athletics. We're talking, there's contact, likely contact. It's much more difficult to maintain social distancing. They're not really the same thing. So I do want to be clear on that, so that people who are maybe observing the meeting are thinking that all small groups are equal, and I don't think that's a fair assessment.
No, I don't think we were making that judgment. I think we were basically saying that sports in general could be thought of as similar to the limited in-person programs. But Mr. Kyler, did you have a?
Yeah.
Oh, Devanshi has her hand over.
Oh, I'm sorry.
Mr. Duffy, you mentioned that there are many ways that we can go about this. So what would be the difference between doing full tryouts versus like return to play similar model?
It's a great question, Devanshi. I appreciate you asking. Well, full tryouts were some of the major areas that Mr. Singer was concerned about. We would have difficulty limiting the number of students. We would want to be careful on how many students we're putting in the gym at one time. So in some schools, for example, basketball tryouts may be 40 or 50 kids. That's going to be problematic to put that many students into a gymnasium at one time. So we're going to need to determine what our tryouts are going to look like, what numbers we can limit, how we can, what numbers we'll accept as far as in the gym at one time, and determining the teams. That's one option, and that would get us moving towards a smaller, obviously would get us down to smaller groups so that we could participate and have athletic events. Return to play would be more of a skill-based setting, and that's what Frederick County is doing at this time. They're working on skill-based. So for an example, in basketball, it's going to be socially distanced, working on skills, and they'll be selecting groups from that point, but not necessarily, not in a competitive necessarily environment. So they're not going to be scrimmaging and playing games at that point. If their numbers permit, they would get to that point, but not initially. So those are kind of the two, I think, are the best ways to describe the two differences. I hope that answered your question.
Yeah, so if it is a return to play format, then would that start the 20-day counter of sorts towards
when we begin our athletic program, we would count that as beginning our 20-day plan. Yes, we would need to be in person. You know, some other school systems are talking about beginning in a hybrid model, or in a virtual model. That would not really constitute beginning athletics. We would need to be in person to begin our athletic calendar. There are a lot of different things in a return to play model that we could still use as well. We could eventually work up to more scrimmage type activities within the pods. That's another option as well. Before we would hope to be an interscholastic program. But again, there's a lot of unknowns right now.
Okay, thank you.
Absolutely.
Ms. Herbert.
What are the thoughts of the athletic directors? Because you knew daggone well one day we were going to get back to athletics. So what are their feelings on starting athletics?
We have been planning and moving forward as though we have December 14th as our start date.
Okay, so, but do they have ideas on how they're gonna, run basketball practice and all that?
Well, that's going to be dependent on what kind of model you would like us to follow. We have, as I said, we have multiple options. We're ready to move in we can move in any direction.
So we can do the conditioning, we can do the what do you call that, 3-on-3 or whatever, that, or we can have full-blown practices.
All of which are options. Yes, ma'am, Ms. Herbert. So we're prepared. I can have something more concrete to give you all next Wednesday, depending on which way you want us to move. We are prepared to move with full on tryouts if necessary. If that's the way you direct us to go, we're prepared to move in a return to play. We're prepared to move in a skill-based. We can move in any direction. We're good to go with what you would like. I'm just looking for direction on how you would like us to move.
And Mr. Kyler, is your card out?
It was, but.
Okay.
Yeah, so it can be again. Yeah, again, and I don't think I have it with me, but I know, some of the athletic facilities were 50% of the fire capacity, and masks were not during the competition. And I know, and I assume they're following the rules. The wrestling tournaments that have been going on that I know about, the only difference between now and a year ago, which is ridiculous, they aren't allowed to shake hands. I think they touch elbows when they start the match instead of shake hands, and then they grab each other and wrestle. The ref's wearing a mask, the coaches are wearing a mask. They come off the mat and they put their mask back on. And that's what they're doing. And I just feel like if that's been going on and we haven't had big issues, there's no reason not to let the kids do it.
And I agree. I said, we have got to go move forward with this. And they don't want to just do virtual or do a conditioning. I think they've done conditioning all fall. We need to move forward.
So our direction so the motion that was on the table and seconded was that we would start sports on December 14th as originally planned. And Dr. Dorsey, you were looking for more direction of what it would look like. It sounds like we're leaning in the return to play format, but could potentially get more details surrounding that from Mr. Duffy at the board meeting next week.
Okay, and again, the return to play is where it's more socially distanced and it's skill-based, not as competitive at this point. So again, that might be more in line with what Mr. Singer would go along with. Is that what I heard?
But if,
Yes, ma'am. Yes, ma'am.
Donna, yes?
Yes, go ahead, Ms. Herbert.
Then does that mean that they can then, does that start their 21 days or no?
Yes, ma'am.
Okay, all right.
But one of the things I would say, if we start in a skill-based and we're not yet scrimmaging, we would be permitted to start on January 4, but we may re-examine as we get closer to those days in that format if our students are prepared for some level. And obviously, we would want to be cautious as far as potential outbreaks of how we would proceed from a competitive standpoint. But yes, the 20 days would begin when we start our tryouts.
Okay.
Yes, that's correct.
I don't have a problem with being skill-based. You got it. I mean, they haven't, well, that's not true because I've been through Hampstead and there's been a lot of kids at the basketball courts. I saw, when it was nice out, I saw 30 at a time there playing basketball, pick-up basketball.
So could we say that we know certain of the sports are a little more risky than the others, right? Like with wrestling, and I don't know that we would be opposed to looking slightly different by sport of how we were. So does it make sense to have Mr. Duffy bring some thoughts back next week that could differ slightly by sport? Or are we basically saying that we're going to use a return to play, or we're going to use a competitive format, or we're going to use a, Ms. Herbert?
I think we should say that we're looking at December 14th to start, and then we should be skill-based first? What do you think, Mr. Kyler, on that?
Haven't they been doing the
Yes.
skill-based?
Have they been doing that?
No, we have
No.
not gotten to winter sports skill-based.
No,
We started with
that's-
fall, then we did spring. Our plan was to get to winter, because originally we were expecting to start on February 1. So our plan was to have started winter, I think next week, and get through to February 1 and start at that point. We never got to winter, so they never got a skill-based component.
Mr. Duffy, I guess my concern would be, if they don't start scrimmaging relatively soon, they're not ready for competition in January.
I don't disagree with you at all, Mr. Kyler.
Yeah.
That's a valid point.
Yeah.
Our hope is to make sure that we're moving forward in a logical progression. Devontae, do you have a question for me?
Yeah, so if we start skill-based on December 14th, then can we possibly move on to regular style practices in January, should metrics permit?
We could move on to practices as metrics permit, as teams are ready. Yes. The calendar would begin with the December 14th. If we begin our practices, tryouts, team selection, at that point, we can start to move forward. Absolutely.
So I think that that's a good model to consider. Having it limited to begin with because of the high numbers, but then possibly looking towards having more regular style practices in January.
Mr. Kyler?
Again, I don't think, if we're going to proceed with sports, I don't think the metrics have anything to do with it, and it's been proven nationwide that it's not an issue. I got an email yesterday of 2 high school kids and how they did in their match in Oklahoma. They're competing, and I personally think it's time to make that step, and I don't think we can start a season saying, and I look at it just the way this has gone up. I don't know if this is an anomaly or we're going to see this through January, but on the 11th when we talked, positivity rate was 4.2 and cases were 12.7. 8 days later, it was 5.8 and 24.9, and it went up as high as over 6 and over 26, and it's back down to 5.1 and 22. I don't think it's realistic to start this with somebody deciding week by week what they're allowed to do that week.
And Mr. Kyler, I agree with that wholeheartedly.
I think we should make a
Yes.
decision of what
They
it's
just
going
need
to
we
look
just-
like, and that's what we're going to do.
just start with practice and start with cuts and go with it, because we need to go forward. Just have practice. And you can socially in basketball, it's not that hard. And in wrestling, it's got one-on-one, and you've been seeing it all year that they've not had trouble in wrestling. So I think we just need to go with it.
Move forward with the plan as originally anticipated.
Yep.
Just on December 14th instead of December 7th.
Yep. Return to play.
Is that the right phrase? Is that return to play?
Well, that's what we started with.
Right.
And then again, what I heard being said is that you start with developing those skills and all, and eventually, you can get up to the scrimmages and more involvement.
But that's, to me.
That's the progression of the skills.
Yeah, but
Yeah.
that's just practice to me.
Mhm.
So what do I call, I don't know. I made the motion to start sports on December 14th, as usual.
So what was it called when they changed to the 3-season schedule starting with winter on December 7th? It was the schedule laid out in that fashion, and we're saying that that's what we want to follow. We're just delaying it by 1 week to the December 14th rather than the 7th.
All right, no.
Ms. Herbert?
Now, are there limitations on return to play? Like how many you keep on your squad, how many, all that stuff?
In our initial return to play protocols that we submitted to Mr. Singer's office, we allowed for no more than 20 students in a pod, and working with those groups during that time. We also limited to every other day activities,
Right.
so that if there was an outbreak or a concern, we could then contact tracing could be in place. If we talk about moving immediately into full-on activities every day, that obviously will impact the ability to contact trace if an outbreak takes place, only because we could be several days behind when we're finding that out. There's not the day in between, but that's part of the component that needs to be taken into account. But it would be a shift from what we are doing if we're talking about moving forward to a full-on athletics program from what we had been doing, which was an every other day plan in smaller groups.
Okay, now another thing. So if I'm coaching basketball and I have 20 tryout, and then I can still continue to cut and then have my 12 or 14, 12 players on the bench or 10 players on the bench. That has nothing to do with it. I can once I say we're going to start on December 14th, we can have a regular practice if that's what we choose to do. Do your tryouts, cut your players, and then go on. Is that correct?
Let me make sure I understand what you're asking. You're asking if we start on December 14th, could we immediately start with tryouts and move forward?
Absolutely, yes, and cuts and that.
If that's the model you tell us to move forward, yes, ma'am, that is an option.
But is that under the return to play rule or no? Yes or no?
That is not part of our return to play protocol,
That's
no,
not
ma'am.
part of it, okay. Well,
Our return to play protocols had us with, again, no more than 20 students in a pod,
right.
And pods meeting 2 or 3 days per week.
Okay, well, we don't want that. We just want to open up and start sports. Regular practices, social distancing.
Okay, so just to make sure that, okay, so the motion, I guess, would need to be amended to say, so we said December 14th, but not under the return to play mode.
No, it cannot be.
It's under the standard mode.
Yes, of athletics.
Do we have a second for the revised motion?
Second.
Second by Mr. Kyler. Okay, so any other comments?
Ms. Savigny, may I chime in one more time? One thing I would like to say as we move forward, and I'm hopeful we will be able to continue this and get to athletic events. It is our expectation, based on everything else, that we will not be having any spectators in the gyms during any competitions during this season. With the indoor is obviously much more difficult than outdoor, and we will be proceeding with that as part of our plan.
Okay, so no spectators at all,
Yes, ma'am, that's correct.
but they would be televised.
That is as long as we have everything up and working, we still need to do a couple tests. Yes, ma'am, that's our expectation.
Our students need a plus. They really do.
Okay, any other comments then, either in support of or against the motion? Okay. Then with that, I will call for the vote. All those in favor of the motion as amended, can I get a verbal aye, please? Aye.
Aye.
Any opposed? Okay, that passes unanimously.
I want to thank
Thank you.
everybody because our kids need it.
All right. Do we have any other motions or topics? Marcia, you've been on a tear tonight. Do you have any other motions you want to make?
I have
Mr. Kyler.
I have a question. And Mr. Singer, I think you're still on. If we're talking about schools January 7th, and going through the registration and going through everything to do it, at some point in time, do we need to talk about what parameters to go back to virtual? And again, till January, that could all be different, and who knows, but based on today's, what would be the intent to monitor pulling the plug on it? Is that a different discussion than what we look at to start?
I think we're looking at the same kind of metrics because it's in that school guidance, and you know, I think part of what we need to be looking at is the trends, and if we trend in a direction like Ms. Savigny thinks we might, where we're similar to what's been seen in Europe, and we're on a downward trend, we would expect those numbers to at least continue to drop to a certain extent. And we're talking about a 7-day average as opposed to a 7 and a 14-day average, as opposed to a single point in time. So you don't get sharp spikes or drops, and we just we'll have to keep an eye on those numbers and see what happens. If if we get an unexpected spike, then we're going to be back having this conversation again, like we wound up with in November.
And I just think that's important if principals are going to be contacting kids and parents on what their choice is, to kind of know the parameters of what we're looking at moving forward. And thank you, Ed.
Dr. Dorsey?
We're asking questions about any topic at this point?
Any
or-
other COVID-19 related
Okay,
update
well,
topic?
It would relate to COVID-19.
Okay.
Some folks have been questioning me concerning student learning hours and how we're dealing with those at this point. So can I just hear a response to that?
Could you be a little more specific as it relates to student learning hours?
Well, I'm thinking of the 75 hours that students earn towards their community
Oh,
service
service
hours.
hours.
learning, okay.
Yeah, their learning service hours.
I got you. Right, okay. Mr. Anderson, I see you there. Go ahead.
Yeah, Dr. Dorsey, I'm assuming that you're just making sure that we are still able to provide those opportunities. We do have someone that's monitoring that, as you know, in a number of our courses. As the students are enrolled in the courses, they actually receive their hours through the courses, as well as doing time outside of the school day. The good news is that we have a number of students that are completing those types of hours in a virtual setting, and we have worked tirelessly to make sure that we can put those students in a position to be successful. But it has been some work, obviously, at times, to make sure that we are placing those students in that position. But if you want more specifics, we can certainly provide you with some more metrics. What in particular were you inquiring about?
Well, I guess my real question is whether the requirements are the same. Are there still the 75 learning hours that should be completed?
Yeah, and as you know, last year, I believe we had a little bit of reprieve there. There hasn't been very many waivers, unfortunately, this year as it relates to the standards and the academics, and we haven't heard much of anything outside of that. I don't know if Ms. McCausland, if you wanted to jump in on that and share any additional insights that you're aware of that I haven't mentioned yet.
No, I can tell you that Colleen Enzer and Jeff Alasakis, who are heading up student service learning, they have been attending professional learning sessions at MSDE and with other colleagues around the state. And they are working with schools, the folks that are school-based service learning coordinators, to make sure they're identifying every opportunity available to our students and families to earn those hours.
But right now, Ms. McCausland, you haven't heard of any additional waivers that the state has provided us yet, as of yet?
No, that's correct. Have not heard that.
Okay.
I do believe that the State Board of Education will be taking up at least some conversation around waivers to certain requirements, similar to what Mr. Anderson referenced from last year. And I believe that since service learning graduation requirements was a part of that discussion last year. I'm thinking that'll also be addressed by the state board, probably within the next month.
Okay, thank you.
As we get more information, Dr. Dorsey, we'll be sure to pass it along to you all.
Okay, thanks.
Kind of along those lines, with the waivers that may or may not be forthcoming, we've been hearing anecdotally that there are a lot of students who are struggling, that, these are prior very solid students that are now getting D's and F's in several of their courses. And I'm curious to know if we have any data that can help us get our arms around that deterioration in grades for certain groups of kids, and if we are indeed reaching out to those kids and either providing tutoring or other intervention services or trying to get them into pods in the high schools.
Yeah.
If we can start getting our arms around that data and the slippage of the grades.
So we have, and I'll be more than happy to start, President Savigny, and then if the school directors want to jump in, please feel free, fellas. So I do want to start off by, we were granted tutoring dollars that I think I shared before, that we put in place, and each school received a certain amount of money based on the number of students that they had in their building, and that's how the money was disseminated. As you can imagine, teachers have been working many hours and working very long days and providing concurrent instruction, and they've been doing several different strategies through not only their first pass instruction, but also what they can be doing to meet the needs of our students. And we've heard loud and clear as it relates to the social emotional needs of our students. And we've actually pushed out some things over the last couple weeks. I think Board Member Battaglia will be familiar with, we were responsive. We shared some of our partnerships. We have many more that we are going to be sharing with our community, our families of our community partners that we have that really support students with that. As far as the academics are concerned, though, the tutoring dollars do set up an opportunity for teachers to be compensated to support students across our school system and individual schools, and in some cases, there's been collaboration among high schools working together to support students in specific courses. In addition to that, what we've been doing also is we've been thinking about new and different ways. The conversation earlier was about compensatory services. We know a number of students have been taking advantage of a lot of the support that we've been providing, but still just not making the grade, if you will. And so what we're looking at there is providing additional time for those students by providing them an incomplete so they can have some more time to recover, if you will, and get some additional support. So we want to be empathetic and compassionate in that aspect as well. And I also just want to go ahead and share that we are looking to the spring semester and figuring out ways that we can provide more face-to-face. As you can imagine, it is a ton of organization as it relates to transportation, as it relates to getting teachers to be available. I believe the conversation in the last meeting also, President Savigny, you were talking about how can we look at compensatory services or recovery services rather better in the future. And so that's something we will be bringing to the board, a multiple year plan to provide support to students, because we know this is going to take a while. This has been nearly a year that we've been in this situation, and we know that within a year, it can set some students back. At the same time, I do want to put this out there. Our students are remarkable. We just had an opportunity, and I think President Savigny, you were a part of the meeting where we had the Teacher Advisory Council, and we listened to our teachers, and we heard loud and clear what they're trying to do for our students. And when we have that distance, if you will, between us, it becomes very difficult. So it's not from a lack of effort, that's for sure. And then I had the privilege of meeting with a number of students yesterday with Mrs. Jones. And we heard loud and clear, Devanshi, you had met with them, Diana and those from our Carroll Kids for Equality, and they had mentioned you, Devanshi. And what they said also, Devanshi, to your point is, and to the board to hear this, is that they were just looking for some consistency as well, not the flipping back and forth of today I'm going to be hybrid, tomorrow I could potentially be enhanced virtual. They're looking for some consistency. So I know that with the board's decision this evening of saying, you know what, we're going to hold our course until January, I know that's going to go a long way for our students and our teachers. But yes, we are putting things in place. We are having teachers work with kids outside the hours after they're working 10 hours a day, and they're trying to find time in the evening as well. So there's a lot going on right now. I don't know if their school directors want to add anything else to that right now.
And Mr. Anderson, I know that we haven't really been able to administer any of the testing in the schools because of the current situation. And that was one of the things that we were saying. We wanted to get that testing done as soon as possible so that we could gauge the learning loss and develop plans around it. So is there something that we can use as a proxy? Can we look at grades at the student level versus the grades that they had the prior year and see if there's this deterioration? I think we need to get our arms around it better. We can't.
There's no doubt, and the answer is yes. And so the presentation you received last month from Mr. Alasakis that really starts to look at our dashboard, we're going to be able to do first quarter types of results comparisons over the past couple years as it relates to student quarter achievement. In addition to that, President Savigny, we were requested by the state to submit an assessment. Basically, what assessments have we completed this year? And so our curriculum team worked with our school teams, and we provided the actual assessments that were completed at each grade level all the way through high school for the first quarter. And so we do have those results, and we are looking at those results. Finally, one of the things that we've already started working on, and Mr. King, I think, is on the screen as well, is that he and I and Lauren Wilder-Schaefer, who is our new local accountability coordinator, have been starting to figure out ways that we will be bringing in students, no matter if we are in a hybrid or an enhanced virtual, where if we get to the place where we have to sit for the state assessment come January in government or science, that we would run it very similarly as we have done successfully with our SAT testing dates. And so we are planned for that as well. So I can provide you and the board members, President Savigny, with an update in regards to our first quarter assessments that were done at multiple grade levels for ELA and mathematics.
Oh, Devanshi, is your hand up again? Oh, I can't even see. Oh, my bar is over Commissioner Frazier, so I didn't see that. Okay, so Devanshi, why don't you go, and then we'll go to Commissioner Frazier. Oh, you're on mute. Oh, there we go.
Yeah, so I was actually just going to ask Mr. Anderson about the academics and all too. So I think that, of course, we can't hold the students this year to the same academic standards that we did possibly last year. And I think with the low motivation, low morale of the students, as we're seeing, which is contributing greatly to the straight A students now getting seasonal. So I think we may need to put in something to help improve student mental health currently, focusing on mental health in our students right now. So what can we do? What programs or some structural changes that we can do to help students with that, with the direct correlation between mental health and their academics?
Yeah, there's no doubt. And so one of the things that the board may be familiar with, and again, it's really in Mr. Streeker's world when it comes to providing the types of services or availing the types of services for our students and for our schools. But one of the things as the person that's responsible for the partnerships is what we're trying to do is to equip our families, because we know that families that never have dealt with these issues before are now dealing with them, right? And so and this is strange and this is foreign to a number of our families. So what we're trying to do, as you can recall, last year we did Navigating Difficult Waters. We're still going to be going on with that conference this year. It's going to be virtual, but we are creating a resource page that will have all of our partners, if you will, that have either are our partners or they actually have an MOU with us that our families can go to and be directed to, so that they can once again be equipped or become knowledgeable about what's out there. Because a lot of times it's hard to understand without having that opportunity of having someone at the school, a PPW or a school counselor, to be able to direct you in the right direction and on a daily basis. This will be something that'll be more of a repository and a place where folks can go to. I don't know if Mr. Streeker wants to talk more specifically about the types of programs that are available, or Ms. McCabe, but that's something that we're looking at, continuing to push out to our community to let them know who we partner with and how they can support our families.
And I just wanted to add to that Mr. Streaker and the Student Services Department just last week sent out a school messenger to all parents, just reminding everyone of the mental health services and supports that we have available in each of the schools, and just, kind of listing out everything that's offered and how parents can access that. Mr. Streaker, did you want to add any details to that?
I think the main thing really is that we remind folks and students and parents, anybody that's with us this evening, that if they have any concerns, the first place most people reach out is their school counselors. But they, even talking to their teachers, really any adult, all of our adults in school, kids connect with a variety of people. So if it's their math teacher, their English teacher, reach out to a teacher and we'll connect you. Usually our school counselors take the first line on reaching out to families, but and our counselors are teaching lessons with the cooperatively with their colleagues, and in addition to that, we're running groups. Our counselors are doing individual counseling. We're reaching out to those kids that we know are on our radar. So there's a whole lot of work going on in that mental health aspect, and it is a challenging time for everybody. We know that. I mean, this is uncharted territory for all of us. But I am proud of the work that's being done in that, and I know how busy our counselors are and the different things that we're doing on a consult basis with our families and the partnerships we have with our community agencies. That they really are stepping up to work with us. So my message really in the big picture is if you have a need, reach out and we will connect you. And get you in touch with folks.
And Devanshi, also your last piece in regards to students not performing at the same academic level as they historically have. You're right. This is true not only across Carroll County, this is true across the state as well as the country right now. And some colleagues and friends that I have that work in higher ed are very aware of this. To the simple fact that kids aren't getting the same opportunities to take the SAT, whereas Carroll County has really stepped up and continues to do that. And I think Eric King's on the call, and I believe we're still moving forward with our December administration for SAT. Eric, is that accurate?
That is accurate, Mr. Anderson, yes, on the 5th. So, that is something I think we're all proud of, and credit to all the school-based folks that we've gotten all the SATs and PSATs done safely and to success for the kids.
And Mr. King, would you just go over some of the programs and initiatives that are happening at the high school level right now to work with our students who are struggling with their grades?
Sure, yes. So every high school has learning pods in place right now. We just collected the data on that. And I know we have spent a lot of time in these meetings talking about students who are struggling. And most of the schools are seeing a 35-40% attendance rate of students that were invited. And there are a lot of factors to that we could go into in a different meeting. But, a school like Westminster High School invited 150 students to their learning pods, and 35 to 40 or so tend to attend. Now, again, there are a lot of factors to that. But so they're reaching out, and so when student A declines the offer, then they go to student B. And of course, some of these students, it's health concerns, et cetera. But so that's been an enormous effort. Winters Mill has their tutoring right after school and also has an evening program. And they're actually starting to team up with Westminster High School to meet the needs of a different group of students who maybe they do need to go work at 2:30 to 5:30, but then at 7 o'clock, they're available for tutoring. And sometimes it can be your actual teacher, and oftentimes maybe they'll just have a mathematics expert, and any high school student, say at Winters Mill on Tuesday night, would work with that person. And the tutoring grant that Mr. Anderson has helped us to coordinate is in place at all of the schools, and again is being done in person and virtually, as well as the pods and the special programs. And before the last meeting, we ran some data on grades at one particular school, and credit to Ms. Troutman and Mr. Guerra for being data miners at Man Valley. But the data is not all exactly, I think, what we think it is. Short story, they had about 15 students that had gone up 2 points in their GPA. I don't mean 0.2, I mean 2. They had about 168 students that had made major improvements in their GPA. They had about 450. Now, obviously, they couldn't. The new freshmen were not involved in this data because they weren't there last year. 450 or so were similar, and then they did have about 225 kids with a decline, and then they had about 25 kids that we could call a nosedive. They have stopped engaging and are really struggling. So we do need to spend a lot of time talking about the struggling students, and I think a lot of time and effort has been spent, but there are students doing better, and you could say that might be they have less distractions, they don't have, they're not working maybe, they're not going to 5 club and sporting activities every evening, and they're focused more on academics. So we're doing everything we can at the high school level and many creative solutions to reach out to the struggling students and to support the students that are doing very well to keep them moving forward so they're prepared for whatever the next year academically holds for them.
And Mr. King, I want to thank you for throwing out some of those numbers. I think it's helpful to try to, that's exactly the kind of data that we're talking about that will help us understand the magnitude of the situation.
Yeah, no problem.
And President Savigny, I just want to say hats off to Mr. King and all the high school principals and teachers, because we are doing some stuff that no one else across the state is doing as it relates to kids go. Like if they will go to practice, they can jump back online at 7 o'clock at night and there'll be a teacher availed to them to support them. That kind of stuff hasn't ever happened before. And so that's how we're meeting the needs of our students.
And Commissioner Frazier, I'll jump to you now. I can't actually see that your hand is up on my screen, but others are telling me it is.
It was.
It was. Thank you. I appreciate that. I remember when we said we're going to have this meeting, we're going to look at whether we're going to go back to hybrid, but we're also going to look at the small groups that are currently working right now. There's 3 groups that I've been, I guess, texted and emailed about quite a bit, are the autism group, the LFI, and the BEST group. They cannot social distance because of the nature of of working with those particular students. Some of those students, for very legitimate reasons, do not wear masks. Because the numbers are so high right now, are we going to look at those groups and maybe reassess whether they should be going in right now, or is everybody comfortable with that? Because I have heard from staff members that they're not quite as comfortable with the numbers being as high as they are right now. So I just wanted to bring that up this evening.
Ms. Battaglia, your card up? Or you want to, okay. You'll wait until after, okay.
So I'll respond, and I think Nick Shockney's on the line as well. Commissioner Frazier, I understand and appreciate the comments there, and I've also heard from various staff who continue to support our small groups. First of all, we know how important the services are for those students and are so appreciative of the work that's being done. We do recognize that in some of the special groups like LFI, like the autism program, we do recognize there are times when there is close contact as the nature of the work that's being done. We are constantly monitoring those programs, constantly monitoring the metrics, trying to keep those programs as safe as possible. As we see issues, as we see concerns, we have shut the programs down temporarily, which, we've done over the past, month and a half to 2 months. It's happened. Mr. Shockney, did you want to add anything else to that?
No, Dr. Lockard, I think you said it very well. Good evening, board members. Our staff, our special educators, and our support staff are working incredibly hard, especially our staff who are working in person with our students in our special programs. We have said this previously. There has been significant challenges to our operations at times due to our staff who are out on quarantine or in the COVID protocol. When those instances happen, our principals and our staff work very creatively to try to still be able to provide those in-person services. Just like Dr. Lockard said, there have been instances, several of them, in which we have not been able to provide in person, and we've had to revert back to virtual instruction for a special program until until we have that ample staff to be able to resume. But as you have heard me say before, providing in-person services does come with risks and challenges, and we've experienced those. Again, our staff is working incredibly hard to overcome those, and I'm very thankful for that.
But you're satisfied that even with the increased numbers that we have, and they've gone up quite a bit, that it's still safe for staff members to be there and for the students as well because of the close contact and proximity, and there's no social distancing, just because of the nature of the programs. And I understand that. I worked in BEST for a number of years myself. I know what it's like. Therefore, I'm just saying, you're still satisfied that it's safe for everyone involved in those programs.
Commissioner, is that a question for me or for the board, Commissioner Frazier?
I was actually talking to you, Mr. Shockey. I'm sorry.
I mean, it has been the board's direction to implement our special programs, and that's what we've been doing.
And Dr. Lockard, to your
You're
point,
satisfied it's safe is what I'm trying to get you. Yes, Mr. Shockey?
I'll be frank. I mean, I don't know if that's for me to answer.
so I mean, Dr. Lockard, I'll send that back over to you. I mean,
Sure.
you basically said we've been following all the protocol, we've
Right.
implemented all of the risk mitigation procedures. When there is an issue, you're taking the appropriate measures.
Right. I mean, I think we set up all of these protocols starting early last summer to try to make things as safe as possible. Commissioner Frazier, I'm never going to guarantee in non-pandemic years that our schools are 100% safe for everybody all the time, because there are things that we'll never be able to mitigate even in non-pandemic years. So I would say to you, we're making them as safe as we can, to fall within the parameters that the state has said. You can still do limited programs. So I don't know if that answers your question or not, but that's the best I can answer.
Ms. Herbert?
Yes, and we need to make sure that everyone knows that Career and Tech is open tomorrow, that Gateway and all those special needs classes, everything is still rolling tomorrow. We have not made any decisions we have not changed anything.
Right, the programs that
Yes.
are currently in
Yes.
are
And I want to make sure
continuing
that
to.
people understand that.
The only vote that we took in terms of changing anything was that we're
The hybrid.
intending to go hybrid on January 7th,
Yep.
if we're in the state metrics at that time.
Mm-hmm.
Dr. Dorsey?
I'll just pick up on something that Commissioner Frazier brought up, because I too have been receiving some emails from special ed staff feeling like they're not as valued, let's say, as other staff members. If we're saying that they have to come in and meet with their smaller groups, whereas other teachers have the opportunity to work virtually at this point. So I think that's the question. Here in this pandemic, the question is, are we saying that, yes, we still want our special ed staff members, knowing that, again, they do have some challenging jobs? Do we still think it's safe for them to come to the buildings and work with the students? Again, I know the students need it. I know there's the need there. But again, the question concerns, again, the staff, but also the students as well at this time with the numbers as they are.
I think we have to continue, and maintaining everything you've talked about.
And there's no motion on the floor, so.
No,
Right.
but
Right, there isn't a motion.
Donna
Again,
gave
I
me a
just-
dirty look, so I said something.
I just wanted, right, to again share that there is the concern from some
Oh,
of,
I
certainly the
understand.
special ed staff members.
Yes.
Right. I think we've had the discussion, on multiple occasions of what is and is not allowed at the state level, and safe. There's never any guarantees, right? But we're managing the risks in the best way that we can, and we do believe that we are managing them as safely as possible. So, Ms. Battaglia.
So I wanted to get clarification too, like, there are certain programs that we have to meet certain requirements by law, especially with those with special education, correct? Like, they need to have certain services offered to them.
Right, we have to meet the needs of their IEPs.
Yeah, so basically, when we went into the pandemic last March, all students that were receiving an IEP were actually then we had to transition to an ICLP, which was an individual continuity learning plan, and so that was kind of to the best way I can explain it would be a bit of an amendment to the IEP to be able to provide the services that we were legally obligated to provide through this difficult time. And so there is no doubt that the more opportunities we have to work with students as we traditionally would, the better chance we have to implement the IEP.
That's why I just wanted to make sure that there are things that we are required to do by law for students that have special needs and they need special services. I just wanted to clarify, make sure we got clarification on that.
Okay, and
Agreed,
board
Mr.
members,
Taggart. There has been no waiver to IDA, and every student is entitled to a free and appropriate public education. And then that's what we've developed the individualized continuity of learning plans to address during this period of virtual or hybrid instruction.
All right, board members, with all of that being said, I think we've addressed all of the issues that we were intending to address tonight. We have a couple of additional recommendations that we've asked Dr. Lockard and staff to bring to the board meeting next week on the 9th. We'll give them that opportunity. And, oh, Devanshi, it looks like you had your hand raised for one last thing.
Yeah, I wanted to ask a question regarding high school academics. So the first semester is going to come to an end at the end of January, right? And that's usually when finals happen for many classes that are semester-wise. So I'm assuming that it won't be in a typical fashion this year, well, not at least same fashion that we did last year. So what are some of the guidelines that maybe changed this year in terms of finals?
Yeah, so basically, I'll start it off, and if Ms. McCausland or Mr. King want to jump in, there's no doubt, Devanshi, that we basically have made it very, very clear that on the flip side, our teachers have been doing an amazing job of teaching the curriculum as they should, and making sure they're holding students accountable for the content and the rigorous coursework of each course. And yes, that students would be taking a final examination. But I also think that we have to go back to the idea that it is very different now, right? And so there has been autonomy provided and professional discretion provided as well. And we made it very clear to our content supervisors. And I'm very confident that our principals are having those conversations as well with teachers. To the point of Mr. King saying earlier, listen, there are some students that are struggling because the field isn't level right now, if you will. And so we have to be empathetic to that as we're going through this difficult time. Yes, we want to maintain the rigorous coursework, high expectations, and high standards, but at the same time, we don't want to put our students in a position to fail. That does nothing. We have to teach kids. Curriculum is important, and this is the person responsible for the curriculum. The curriculum is important, but the kids are more important, so we have to teach kids through this difficult time.
And will finals still count towards 10% of the final grade for students?
Yeah, so Mr. King, do you want to address the conversation that's happening?
Yeah, I would yes, that's a great question, Devanshi. I mean, one of the things we've all focused on was teachers need to teach the most important content, and if they don't cover everything, I'd rather the students learn 90% of the content in that curriculum, and we may have, and President Savigny mentioned this at the beginning of the meeting, we may have to go back next year in the following course possibly and review some things. So I would expect final exams to cover maybe a little bit less content, and obviously teachers have been molding them. I mean, many classes, Q1 classes ended at the end of first quarter. And I was not aware of a single issue of how a Q1 exam was given. So I'm confident that they'll be done as well as possible. I mean, there's obviously a trust factor with students if we're still in the virtual setting at that point. But honestly, as a parent of a high school student, there are exams I'm aware she's taken I couldn't have helped her with if I had chosen to. So, and I think most parents are in that position unless it's their area of expertise. So But that would be what I would see as the biggest changes. It just might cover a little bit less than it would have in normal times, but we still want to have, final exams.
Yeah, and basically, again, Devanshi, it's the discretion of the practitioner, of the expert. And we feel comfortable in providing that.
Thank you so much for the clarification.
Thanks, Devanshi. Okay, so board members, with that, I will call for a motion to adjourn. Moved by Ms. Herbert.
Second.
Oh, I'm sorry.
It's okay.
Is it- okay.
I'll just email Mr. Anderson my question.
Okay. Do we have a second?
I'll second it.
Seconded by Dr. Dorsey. All those in favor, can I get a verbal aye, please?
Aye.
Any opposed? It passes unanimously. We are adjourned. Thank you, everyone, and we'll see you next week.